how common is our pectoralis injuries, our pec injuries? The answer is actually incredibly common, right?
Yes.
Um, Anybody that kind of knows the grading of tears, typically tears are graded one, two, three. Like one is like partial, two is like, like definitely like more in depth, and then three is like you completely rupture, right? The good news is we typically don't completely rupture like our pec
It's
muscles.
pretty hard to
Yes.
do.
However, interesting enough, when I was preparing for this podcast, I did find that there are multiple orthopedic journal articles, and some of them actually published on the National Institutes of Health, that say over the last 20, 25 years that the rupture of pec muscles is actually on the rise. Their hypothesis is it's most likely due to the increase of people doing weightlifting.
Hmm.
So we'll get into that a little bit later. I don't want to jump too far ahead, but definitely maybe people trying to go too hard and trying to max out their bench press, and then next thing you know, you got a grade three tear, and that's no fun for anybody. But this is an extremely common area for people to at least be carrying undue extra tension and irritation in, and it's
Hmm.
definitely going to sort of like clinically mess with everything else up the chain in the upper back of the neck. Again, more on that to come in the next handful of minutes. And as far as we did mention that subacromial bursa, found statistics that actually say that about 0.5% of all primary care doctor appointments have something to do with either the pec irritation or the subacromial bursitis. So, I mean, not a massive amount, but of all people that go to the doctors and say, I have a musculoskeletal complaint, and they choose to go to their primary, 0.5% is not something to completely ignore. So it's certainly common enough that,
Definitely.
well, that we feel like we should talk about it.